Imagine having a disease that could stop you from talking, a disease that could stop you from using the left side, right of your body, a disease that could alter your state of mind. It is very important to know the signs and symptoms of a particular disease that could end your life. The symptoms that I have mentioned should not be taken lightly. These are risk factors of what could result in a heart attack. Cardiovascular disease is a disease that you should really educate yourself on with the signs and symptoms. Being someone who works in the medical field, who works at Arkansas Heart Hospital, where that's our expertise, I've had time to spend hours researching, studying, and practicing this topic before presenting this speech. Giving knowledge and education to patients in the field can be very rewarding. You can teach them things to do, things not to do, what to eat, how to exercise, how to manage their disease process. So knowing someone personally who has suffered from a heart attack can be emotionally inhibiting. It can change your life, it can change their lives, and it can be very hard on somebody. The outcomes of someone who survives a heart attack can be as little as mixing words up, but it can be so extreme to where that patient can't function and can't use their body to do the daily activities of daily living that a normal person would do. Today I will be informing you about a disease called cardiovascular disease, the signs and symptoms, and a review of the disease process with some risk factors, and the prevention of how to prevent cardiovascular disease. So with my previous nursing knowledge, just working in the medical field, working in the ER at Encore, most men who come in and they're like, oh my gosh, I'm having a heart attack, an elephant sitting on my chest, like that is usually their signs and symptoms of an abnormal EKG. It's the signs and symptoms of their troponin, which is an enzyme of your heart. And that's usually elevated, but that's usually all that they come in with. It's just like, oh, my chest hurts. I feel like an elephant sitting on my chest. So then we do the protocol of where we have to do all of the cardiovascular treatment. And then when women come in, it is completely different. Like, you don't even know that they're having a heart attack. Their symptoms are so vague. It can be just like, oh, I'm having some left-sided arm pain. It could be, oh, I feel a little nauseous to my belly. It could be like, oh my gosh, I'm so short of breath, I can't breathe. And it could be as little as, like, I'm nauseous. And so it is very important to take every sign and symptom of somebody who comes into the ER seriously, because it could save their life. An article from the Mayo Clinic online called Heart Disease states that symptoms of coronary artery disease, which is also known as CAD, can include the chest pain, can include chest tightness, chest pressure, chest discomfort, just a little bit of angina. It can have pain in the neck. It can have pain in the jaw, throat, numbness, tingling, weakness in the arms, like we said, that left side when the women come in. So now we've reviewed kind of the related signs and symptoms of what to look for. So let's flow through and elaborate a little bit more on this disease process so we can have a better understanding. So CAD is a common heart disease condition that affects major blood vessels with the heart. So if your heart is not getting enough oxygen, usually from like some plaque that has broken off, and plaque comes from like fats, cholesterol, eating red meat, eating bacon, having a lot of grease. I mean, we live in Arkansas. We eat grease. We eat fried food all the time. But and other substances in this artery wall, they get blocked up, get broken off. This plaque gets stuck. Our oxygen can't get the oxygen that our heart can't get the oxygen that it needs. So our heart is struggling, and so that's where all these signs and symptoms come from, is because our heart is hurting. An article from American Heart Association online called What is Cardiovascular Disease states that CAD is a disease that includes many different types of disorders, and these disorders can be as little as having a heart attack and then letting that heart attack go so far to where it involves a stroke, heart failure. You can have arrhythmias with this, because usually if a person has AFib and this is an arrhythmia of the heart, they're usually on blood thinners so that this plaque does not build up and happen so that it breaks off somewhere. So usually like a lung or to the head, and that's usually what we call a stroke. Heart valve problems. patients have heart valve problems all the times, and at Big Heart and Little Rock, we do a lot of heart valve replacements. So it's very important for these patients to know their risk factors and how to treat themselves and how to manage this problem. So now that you've went over a little bit of the signs and symptoms, we've known a little bit more about the disease. Let's look at some modifiable risk factors, what we can change and what we can't change. So some things that we can't control, like age and race and family history, these are things that we can't control. So it's very important to know what we can't control versus what we can control. So an article from Center Disease of Control and Prevention Online called Heart Disease Facts states that through multiple studies, it's been shown that African American women are more susceptible to this disease. So it's very important that they know that they are more susceptible and that they do need to get checked out. And then family history. If your mom or dad or your grandparents have had history of coronary artery disease or any heart problems, you need to be following up with your primary care as well, because you're more susceptible to this disease. And then some things that we can control. We can control our weight. We can control that we don't smoke. We can control our physical activity. And we can control our diet. So these are things that we can do to help ourselves to prevent this disease. An article from Illinois Department of Public Health Online called Disease of Heart and Stroke Illinois' Leading Killers says that being overweight, being obese, smoking, physical inactivity, and having an unhealthy diet are just some of the major risk factors that can lead to heart disease. So how can I prevent it? How can I manage heart disease? So some healthy habits that we can choose is eating properly. So choosing foods that are low in fat, because it leads to that plaque, low in salt, because low salt, it makes a happy heart. Intake plenty of fruits and vegetables. Eat less red meat. Eat fiber-rich whole grains, lower your fattening dairy products, and limit your sugar consumption. And it's like, oh my gosh, that's like my whole diet. I'm going to have to change my whole life. So it's just easier to intake less red meat and to increase more fish. Fish makes a happy heart too. And then to decrease your sodium intake, because sodium can be very detrimental on the heart. It can make a lot of blood pressure issues. And then tobacco cessation. Tobacco cessation is one of the most preventable risk factors in CAD. And tobacco increases heart rate, constricts these major arteries, and can create irregular arrhythmias, and then it can also raise blood pressure. So all of these contributions to each other, it just says that tobacco is a no-go. Tobacco can also constrict these vessels and make plaque more presentable in these arteries. So choosing not to smoke is one of the major things I tell people to do when they're trying to prevent heart disease. And then, of course, just take charge of your own medical condition. If some of these factors have related to you, go and follow up with your PCP. See things that you can change in your life. Take out the red meat, reduce the salt, intake more fruits and vegetables. Do things for you to save your life. And with conclusion, I would just say that heart disease is one of the leading cause of death in men and women and all ethnic racial groups in the United States. So it's very important to take this disease very seriously. So by knowing the education and the disease management of cardiovascular disease, I hope that you take this information and continue to educate your mom, educate your dad, educate your neighbor, and just know that this disease can be prevented and can be managed. And then that knowing the disease process, risk factors, and prevention of cardiovascular disease could save someone that suffers from the silent killer. And then knowing the warning signs that I've presented and talked with you about, you can take responsibility for your own life. You can save yourself, you can save your neighbor, you can save your mom and dad.